we have a highly commended nomination that talks about community health hubs that have been developed to create personalised and integrated care in local communities to bring people together, to recognise what they have to offer, how they can better cope with their own health and well-being, as well as better support those around them. The hubs offer a range of physical and psychosocial health services in local everyday spaces, like village halls, through community matrons, district nurses, health coaches, and other health professionals, including medication reviews. The hubs encourage a new relationship between health and care professionals and others in their community, and people are invited on a social level through a friendship cafe approach, sharing food, tea, and company, before encouraging people to talk about their health and concerns and what matters to them. The hubs offer a range of activities that help people engage with their health, including activity and movement sessions such as armchair yoga and walking groups, knowledge development through groups such as Dementia, Cornwall Stroke UK, CAB, Age UK, and Volunteer Cornwall. One great quote that the judges loved from this application was, "It takes a village to raise a child, and it takes a community to support a person." The highly commended in the Connecting People category goes to Imagine If Community Health Hubs, Cornwall.
The nomination evidence shows how a team has come together to recognise and recruit volunteers who had interests and hobbies that are aligned to a young person who had been a frequent flyer to emergency department and a paediatric assessment unit. They further connect these people who mentor, encourage and support young people through a mentorship programme, connecting people and thinking differently, and most importantly, building engaging communities. This has led the judges to award this team as the winner of this category. The programme was shaped by young people from the very start, with social workers collaborating with them to understand the social and environmental issues, what support would be preferred, and how young people would like to be engaged with. Young people are also now involved in the rebrand of this project, supporting with colours and the design of the logo, t-shirts and materials. The project is a joint partnership between Great Western Hospitals, Swindon Borough Council and funded from Home Office Safer Streets funding through Swindon Borough Council's Youth Justice Service. The winner of the Connecting People Awards is Way Beacons, Great Western Hospitals and Swindon Borough Council.
And the highly commended in this category is for an inspirational programme, making meaningful change and clearly demonstrating confidence building and sustainability over time for people receiving this service. There was clear demonstration of a personalised approach based on what matters to the individual and designed to build their knowledge, skills and confidence at a pace that suits them. The judges loved the stories and impact data that demonstrated how much of a difference this has made beyond one individual. The programme supports people through a year-long personalised programme that helps people with complex emotional needs, helping them to achieve personalised life goals in a what matters to you based approach. The judges thought, this is a great programme and is truly life-changing. The highly commended for Giving Confidence Award goes to the Anchor programme in Gloucestershire.
This is a fantastic example of how taking a personalised approach, collaborating with people with lived experience to develop support for them, builds knowledge, confidence and skills. The judges liked this programme because it put people and their carers at the heart of its development, review and refinement. It clearly demonstrated influencing policy and public sector service delivery. The equal valuing of lived and learned experience is evident, with significant impacts on the quality of the carers' service demonstrated. The feedback from the pilot was overwhelmingly positive, rated at 5 out of 5 from those who attended, and we'd recommend this course to others. The course participants have since formed their own peer support group, facilitated by the Carers Assessment Service. They continue to support each other and have opened a line of communication with professionals involved in the care of their loved ones. So it's my pleasure to announce the winner of the Giving Confidence Award. I'm just going to rip this. Is Carers Assessment Service Somerset.
The highly commended in this category is a nomination which demonstrates how people and communities from economically challenged areas were enabled to have choice and control over their health and mental well-being. The initiative of using exercise and attending fitness classes, I think you need initiative to do that, in leisure centres with no cost to the participant, has given back control to service users, giving them choices and lifestyle options from a what matters conversation. The outcomes have boosted confidence, seen alternative choices made that help people to avoid unnecessary hospital and GP visits. And this team has helped people to explore holistic solutions to empower their personalised health and wellbeing outcomes, benefiting not just the person, but the health and care system too. So they highly commended the choice and control category goes to Central Bournemouth Primary Care Network.
This application demonstrates that with the support of the local communities and multidisciplinary teams, people's knowledge, skills and confidence to self-manage their own care is markedly increased. When treatment is required, they can be part of a shared decision-making conversation with health specialists to help them make the right choice for them. One of the many positive and kind comments in the nomination was from the Personalised Care Project Manager, who said, "I can't express enough my admiration for their commitment to their roles and to the first-class service they give to our patients." The delivery of prehabilitation enabled people with cancer to be fully engaged in their personal care journey from the initial stages of diagnosis. This team was determined to offer personal empowerment, physical and psychological resilience, and better long-term health outcomes. The team was put forward by various nominations for 3 award categories, and this shows how they've worked to deliver personalised care. So the judges are delighted to announce that the winner of the Choice and Control Award is Cancer Services Torbay Hospital.